All right. I think we're starting again. This looks good. Okay. Yes, you guys are correct. This is a snake, and there are foreign bodies, and he is intubated to the level of C17, which we decided was a good thing because he has reasonable aeration of his lungs, I think. Anybody know what snakes around here like to eat? Okay, yes, mice. These aren't mice. What else do they like to eat? Batteries? That's good. You're already thinking like a pediatric radiologist. They like to eat eggs, is one thing that they like to eat. And this snake thought it was eating eggs, and instead it was eating some other white, roundish object. You want to take a guess at what these might be? Coins? No, they're spherical, not. They're golf balls. Yeah. Anybody here a golfer? Do you know the difference between these two golf balls?
Is one like a Pro V1 and like the other one's just.
I honestly don't know. I'm asking because I don't know. Yeah.
I know that the core is like a very important thing that's different between golf balls. So I'm wondering.
Yeah, so clearly these are different. They're both golf balls, so I assume on the outside they both look like golf balls, but on the inside their core is different. So one has a concentrated, dense central core, and the other is more homogeneous throughout the thing. I don't know what that means. Probably something about the flight, and maybe I don't know. Maybe you use one in certain situations. But in any case, the snake thought it was eating eggs and instead ate golf balls, and somebody brought it to the vet, and they decided to do an X-ray and apparently surgically removed these, and the snake did okay. We're going to talk about foreign bodies in humans, and specifically small humans, kids. There's lots of different types of foreign bodies that you can get. Traumatic, ingested, aspirated, inserted, iatrogenic. And we'll talk a little bit about all these and focus on a few particular ones. We'll start with this traumatic foreign body. It's not what we see most of the time, but here's an example. And we had a beautiful case of this last week, or maybe the week before, on ultrasound. This was a 12-year-old, and 2 months ago his hand was punctured by a tree branch. A couple rounds of antibiotics, and it's still draining, so we did an ultrasound. On the ultrasound, you can see this area of linear abnormality here, surrounded by this area of hypoechoic. And I'm trying to show my mouse, but apparently I can't, so we'll just have to use our imaginations here. So you can see that linear area of echogenicity with the surrounding low density. And this is what a splinter or a stick or wood looks like on ultrasound. Wood has variable appearance depending on how long it's been in your body because it initially is filled with air, and so we'll have a lot of shadowing on ultrasound, but as it, over time the air gets absorbed and it becomes more penetrable by the ultrasound. So you'll see it looking like this. Frequently we'll have inflammation or fluid around it or develop granulomatous reaction. Here's another example here, a 5-year-old girl with a splinter but persistent drainage. Notice the similar story here. It's also very helpful to know exactly where the problem is. So you can't, if you don't know that you're looking for a foreign body or you don't know where it might be, ultrasound might not be as helpful. But if you know where you're looking, ultrasound is very, very good. So this is a great example of a splinter or a piece of wood embedded in the skin there. Similar appearance, linear echogenicity surrounded by low density stuff. And then in cross section, you can see it's very thin. Ultrasound for foreign bodies has a really high sensitivity if you know where you're looking. Again, you can see radiolucent objects, which is really helpful, but obviously operator dependent. You have to have a good clinical exam, and you're limited by all the things that limit ultrasound in general. So air in the way, depth of the foreign body, position of the patient and foreign body. There's some pretty good literature on that you can see down there at the bottom. One more example here. This 4-year-old girl stepped on a plastic Easter egg 6 months ago and is now having intermittent pain. Exam is normal. So 6 months ago something happened, but now everything looks okay. X-ray here looks great. We don't see any abnormalities here. Challenge anybody to find a foreign body or anything else. Just looks like a normal X-ray. But because of persistent pain, and somebody thought they were feeling a lump, they went on and got an MRI, and you can see a marker placed over here. So we have a T1 on the left, a stir in the middle, and then T1 and stir on the right. And you can see that there is an abnormality there underneath that marker. At the time, we didn't know that we were looking for a foreign body. That history didn't come across for us, so we called this a mass. And technically, we're correct. The mass was excised and it looked like this. So it was this kind of granulomatous inflammatory mass that you can see. And when they cut it open down the middle like that, they found that thing at the bottom right in the way. And that thing on the bottom, anybody know what it is? A candle, a crayon? Nope. This is very magnified. So very, very, very blown up here. No guessing. This is a toothpick. Toothpick. I should say it's about half a toothpick, really. The pointy end is hiding behind my face here, but you can imagine the pointy end down there on the right. But yeah, you can see the little wood grain there that makes up the toothpick. Here's a better picture showing the butterflied open granuloma and then the toothpick underneath it. So if we had had history, we could have looked at that MRI a little bit more closely and maybe said that there was an object hiding in there causing this inflammatory reaction. All right, let's move on. Aspirated foreign bodies, something we think a lot about in kids and in adults and anybody. They can be life-threatening at times and are generally a pretty serious thing. We have lots of different ways to evaluate for potential foreign bodies in kids, and X-ray is kind of a starter. Anybody want to say what we're looking at on this X-ray? Hyperinflated left lung. Good. Again, history is our guide here. It's important to realize that asymmetry of the lungs can be due to one side being smaller or less well inflated. But when you are looking for foreign body, we make the assumption that we have air trapping and hyperinflation, and that's the abnormal side on this patient's left. So good. Very asymmetric, very hyperinflated left lung. We'd be worried about a left main foreign body causing air trapping. I'm not going to be able to show how I usually do because of the way this video is set up, but here's an example of an image with obvious air trapping on one side in inhalation and then exhalation here. So you can see the difference in that right lung getting smaller, the left lung stays the same, still very hyperinflated. And normally I would go back and forth, and you could see the right lung get smaller and bigger, but because of this video, we're not going to be able to do that, unfortunately. You'll just have to imagine it. But that's what you can do when you're at the workstation. Scroll back and forth between the two images. It really accentuates the motion of one lung versus the other. I brought in this patient because I think it's a good example of what lungs ought to do. You know, we think about it all the time. We're like, yeah, lungs, you breathe in and breathe out, and they get bigger and they get smaller. But we don't think about what that means radiographically. And our techs are trained to take image at inhalation. So we always get these nice images where you're inhaling a lot. Every once in a while we miss and we get a partially exhalation image, and very rarely we'll get an image like this one where the kid is breathed out all the way. So this is almost an exhalation image on the right, and you can see on the left the same kid, 39 seconds difference. The lungs change volume dramatically between inhalation and exhalation. So this is why we can use this as a tool for foreign body evaluation and looking for air trapping. Another thing that you can do, and this is another case where you have left-sided hyperinflation, is compare them in decubitus views. So now I have on the left side of the screen is the right lateral decubitus and the left lateral decubitus on the other side. And it's a little bit hard for me to tell sometimes which lung ought to be the abnormal one in which position. So one thing that you can do is just rotate the exams like this. Put the side down that's actually down towards the ground. And then you can tell, well, here, this side that's on the ground, yeah, it definitely got smaller than this side over here. And now on this image on the right side of the screen, that dependent side that should be getting smaller because the kid is laying on it didn't deflate. So this is another sign that the kid is having air trapping on that one side. This is a normal example of right lateral and left lateral decubitus views. You can see the difference in how the lungs should behave. So this would be no concern for air trapping on this example. Ingested foreign bodies. We're going to pause for a second at this one right here because this is a really important one. We're out of the airway now, and we are looking at the esophagus, and there's clearly a foreign body here. Does somebody want to tell me what kind of foreign body we're looking at? Battery, yeah. Everybody's saying battery. Why? Why are you saying battery here? Perfect. So beveled edge was one thing, and on the image on the right, you can see that beveled edge. It doesn't make a nice rectangle. You see that beveling. And on the image on the left, you have the lucency in between the two lines, so that's called the double density sign or the ring sign. And both of these things are things that are seen with batteries. And we're concerned about batteries. Why? Caustic burn. And when you say caustic, what do you mean by that? Yeah, so that is something that can happen, but usually the injury that happens because of batteries isn't due to battery acid or caustic burns. There's another type of injury that happens first.
There's another battery.
If there's two batteries, that's bad, yeah. But it doesn't require, yeah. It doesn't require another battery. What else do batteries do? What do we? Yeah, current. So an electrical burn. So it's not that you eat a battery and suddenly the thing just pops apart and all the acid spills out. You eat a battery and the mucosa connects the anode to the cathode. And especially with button batteries where the anode and the cathode are very close to each other, separated only by that small little ring that you were talking about, your mucosa lies across that gap, connects the circuit, and current flows through the mucosa and burns it. And that's what causes the initial injury most of the time. Now, if a battery sits in there long enough, eventually it will dissolve. It happens more quickly if you have electrical current happening at the same time, and you can get chemical burns. But electrical burns are the initial thing, and that's compounded by pressure effects as well. So anything in pressing up against mucosa can cause damage, even if it doesn't have chemical or electrical burns. But this is why batteries are so dangerous. Anything else on this X-ray you guys might be concerned about? Do you think that's what it is? Proximal dilation of the esophagus. Sorry? Okay. What are you worried about? It can cause erosions. Yeah. So Laith, you're talking about the lucency that's around and above it. Yeah. And I think you're talking about the same thing. Basically, the soft tissues around the esophagus become burned and eroded, and you get pneumomediastinum, or basically you get perforation of the esophagus. And it looks like something unusual is happening here, and I'd definitely be concerned about that. So what do you do? You're worried about an abnormality, an erosion or perforation of the esophagus. What's the next step in this case? Yeah, call the ordering team. Good. The end result being get the battery out of there as fast as possible. So unfortunately, this kid, they decided, let's look at that some more. This wasn't at our hospital. This was an outside hospital. Maybe they didn't recognize it as a battery. Maybe they wanted to evaluate the perforation. But in any case, this is something that should never have happened, but it did, and I have the pictures. So we'll look at it. And you can see that there is a loculated collection of gas around the foreign body. And this was a contained perforation with pneumomediastinum right at that location. So don't ever do this. Call the team, transfer the patient wherever they need to go to get this out. Yeah, they'll get plenty of imaging later on. This kid unfortunately went on to develop chronic strictures and still comes back to get this dilated and evaluated over time. And this is one of the milder complications that can happen with this situation, strictures of the esophagus post injury. If it had eroded into the airway, it can cause additional problems. If it erodes into the adjacent large vasculature, that is oftentimes fatal. Thankfully, not very common, but it's one of the big things that we get worried about. So here's an example. I know it's covered up, but it says, Mom says he swallowed a glass bead. What do we think? You're not on camera, but you're shaking your head. Anybody else have any thoughts? Yeah, this is another battery. So the point of this one is to don't listen to the patient. Don't, like, if you see something that looks like a battery, don't pass this off as a glass bead. It's still a battery. You have the same exact situation as the last one. This one is a little bit of a different size and different thickness, but these come in a million different sizes and a million different thicknesses. So don't let that dissuade you. You still have the ring sign or the double density sign, and you still have the beveled edge on these two images, frontal and lateral. It still is in the esophagus, and it still can cause the same problems. So let's take a closer look. And for foreign bodies, this is really important. Magnify the images, window it so you can see the foreign body as well as you can. Here's the frontal and lateral that we were just looking at, magnified up, so we can see the detail of the structure really nicely. Definitely a battery, definitely a cause for concern. So this was an outside exam, and they appropriately transferred the position, the kid to us. They didn't have the ability to get it out on their own, so they're like, okay, send him to children's. That's what we did. So this was the outside hospital X-ray at 1:15, and then at 7:20, this was our X-ray. What do we think? It looks like it's eroding a little bit. What does that mean to you?
Maybe that the battery acid could already be leaking out and causing damage in the esophagus.
Yeah. What this indicates is that this battery was charged. So lots of times when a kid swallows a battery, it's a dead battery. Someone took it out of their hearing aid, or they fell out of a remote control or whatever because it was depleted. It was a dead battery. The kid swallows it. It's a foreign body, yeah, but it doesn't have enough charge to do anything. But you don't know that based on the imaging. But in this case, we do. This battery was charged enough that it completed the circuit. And the way batteries work is that when you complete the circuit, it does actually erode the anode and the cathode a little bit as you use it. So that's what happened in this case. And this battery discharged over the course of 6 hours into this kid's mucosa. So that's a problem, not good. If it happens enough, it'll leak out the battery acid, although it tends to happen on this outer ring here. So most of the time, battery acid doesn't really leak out.
Which one is the first one?
The left image, the 115.
So what's the difference between these two images? I don't understand.
Time.
No, at the appearance of the difference between the X-rays.
So the metal rim around the edge of this,
Has defect.
it now has defects on the later image because it's actually corroded away as the battery discharges.
I'm sorry, the difference between this patient and the other patient, that we realized that one has eroded and is in the mediastinum. What's the difference between these two?
There's not a big difference other than we can see the erosion happening on this one. Yeah, the same process though. It could be that this one just didn't erode all the way through the mucosa, so it hasn't caused that problem. So here's the next case. Again, I'm taking this image here and I'm magnifying it way up, and then windowing it so that we can see it best. What do we think of this one? Same thing? Okay. Looks like a double density sign, right? I don't have a lateral view, so it's hard to see a beveled edge, but we'd be worried about that. How about now? Why?
Shape on that.
What shape on lateral view? The shape is, it's not beveled. It looks like step-offs, right? So we have the frontal view that looks like this, sure looks like a double density sign. Are you 100% sure that this is not a battery? I think you can be actually in this case. But if you're not 100% sure for whatever reason, treat these conservatively because you don't want to leave a battery in there accidentally. You're absolutely right. This is not one coin, this is 3 coins all stacked together. So you have 1, 2, 3. That's why it looks like this. I think it was a quarter, and I don't remember what the other ones were, but yeah. So, but make sure that you're confident in what you're looking at before you make a call. The lateral view is oftentimes very helpful. This is another example. Different kid, different case. Same double density sign. I'm not giving you the lateral view. But I've given you a magnified view. Is there anything about that magnified view that catches your eye? Irregularity of this front. So is it the same irregularity that we saw on that battery from earlier?
No, I think it's coins are like this.
Yeah.
They have some
Yes, serrated edges. Yeah, exactly. This is the edge of a coin. So this is a very regular irregularity, whereas that other one that we saw was an irregular irregularity. This is a coin. So, in fact, this is 2 coins again. And you can tell this one is a little bit harder because I don't have the lateral view to give you. But yeah, coins can be tricky sometimes. And again, if you're not sure, get it out. Okay, foreign body search. What do you guys think? Something in the nose. Good job. Don't forget the edges of your radiographs. And specifically, our foreign body protocol here includes the nose. So always look in the nose. And you said something. Can you do better than that?
Is that a thing?
I think that might be like a tight shirt or something. The neck is okay. We're definitely looking in the nose. But what is that thing that we see up there? A piercing? Some jewelry? This was actually a foreign body. And if you look really closely at it, you can see that it looks a lot like some of the ones that we saw earlier. In fact, has a tiny little beveled edge, and I think I have a magnified view here. So again, magnify it up. You can see the beveled edge. This is another battery. This kid decided not to eat it. He wanted to smell it real bad and stuck it in his nose. Again, might not cause some of the more serious complications, but can absolutely erode through the mucosa in your nose and cause other things like perforations of the septum. You need to get this out as well. All right, here's a 7-year-old male with chronic trach, and now with increasing secretions. So we see the tracheostomy tube, and it looks fine. Behind the tracheostomy tube is another thing. It shouldn't be there. Wait, I heard it. What was it? A coin. Why? Why do you say coin? Why is this not a battery?
It doesn't have to be
Okay, it doesn't have the double density. No beveled edge. There's something even better than that that you can use to tell me with 100% certainty that this is. So this is another reason to magnify these and really window them very heavily. The image that we were just looking at was the one on the left, and you can kind of make out that little building. I think that's the Jefferson Memorial of a nickel. The bottom image down there, you can actually see both the front and the back at the same time. So that's a Lincoln and the Lincoln Memorial of a penny. If you can see these things, they do not make batteries that have Lincoln and Jefferson embossed on them. So if you see these, you can be 100% certainty that you're dealing with a coin. And it's kind of fun to say, oh yeah, this kid swallowed 6 cents, or this kid swallowed whatever. I have one really great example of a kid that swallowed a Chuck E. Cheese token where you can see the mouse. And I have a Susan B. Anthony that looks real cool. So I've got lots of examples of these. They're pretty fun. One thing that you cannot rely on, however, is the size. Do not measure these and think you're getting an accurate measurement. I already made the point that you have batteries that come in every single size, including ones that come in the exact same sizes as all the coins that are in common circulation here in the US. But here's an example of what quarters and also some magnets look like on X-ray. So I just took quarters and I stacked them up on these pillows and or on these foam pads, and I took an X-ray all at the same time, and there they are there. And it gives you kind of a visual representation of the magnification effect that's inherent with these types of X-rays. So you have beam divergence, so anything closer to the source is going to be more magnified. That will translate to a larger distance when you measure it as well. So when you're measuring things down on the centimeter and sub-centimeter scales, your measurements are going to be inherently inaccurate. Do not rely on them as a clue for whether this is a coin or a battery. I mean, you can get on Wikipedia and find that a quarter is exactly 25.6 millimeters, but yeah, don't use that. All right, let's move on to some more distal ingested foreign bodies. Same kid, 2 different views. I will tell you that the foreign body in the pelvis was allowed to pass. We don't know what it is. I wish I did, but I don't. Let's not talk about it anymore. But tell me about this other thing in the upper abdomen. Anybody want to hazard a guess? It looks like an insect, yeah. It's got pointy things, yeah. Anybody else? A few nails? Did you say a hinge? A door hinge? That's a good thought, with the nails in it, maybe. Okay. Yeah, so whatever it is, it looks bad, right? There's pointy bits, and we don't like pointy metal things in our body. This kid was also symptomatic, and so when you have pointy things in the body and the kid is symptomatic, they took them to the OR and found this. So they opened the kid up, they did an open excision, and this was staring at them. They did not look in the bowel, they haven't done any enterostomies to look inside. This was on the external portion of the bowel, and you can see this foreign body just hanging out on the outside wall. And you can also see there's some erosions in other places. The reason is because this kid swallowed a whole bunch of magnets and then a whole bunch of roofing nails all together. So magnets and nails are bad to swallow individually, but when you put them together, you cause all sorts of problems, and problems this kid had. So they had to get a portion of their bowel resected. You can see it here. That nail is stuck onto the magnet, which has eroded through the wall because on the inside there's more magnets, and when you get two magnets stuck together with bowel in between, it will erode through. And then you throw nails in, of course it's going to pop the bowel. This is the case that started me on my interest of foreign bodies in general, because I was like, wow, how does this happen? How do you let kids swallow these things? And now that I have a kid of my own, I'm like, how do you keep kids from swallowing these things? In any case, yeah, this is just some other views. You can see the mucosal or the damage to the wall of the bowel on this one. This is a roofing nail for those of you in construction out there. And yeah, there was actually other little plastic bits and other things that were stuck in this. This kid has swallowed like a handful of just random stuff from somewhere. Here's another example. 20-month-old boy presented to an outside hospital ED with 2 days of vomiting. What do we think? Anybody concerned about it? What's that? No, this is what you get. A ring? Okay, yeah. There's something there, right? It looks metallic. Any other guesses? If it was on its side, maybe a big coin. Yeah. Magnet stacked. Yeah, that's a good thought. So they identified this was an outside hospital. They identified this as a foreign body. The kid was symptomatic, but they identified it as a solitary cylindrical metallic foreign body, and they decided to watch it. Unfortunately, the kid got sicker and sicker and sicker, and then became septic, and then died. On autopsy, when they went in and found it was a stack of magnets all stuck together that had perforated and actually caused a focal volvulus as well, and the kid had become septic because of his bowel perforation and died from complications. You can see here the loop of abnormal bowel with the perforation and the magnet sticking out in between them. On close-up view, you can see a couple of magnets stacked right here. Look really, really closely at these. Sometimes you can see that they're separate magnets. Sometimes you can't. If the kid is symptomatic and they have a foreign body, they need to go to the OR. Your surgeons should know this, so there are guidelines about these sorts of things that we don't have to go into, but just keep that in mind.
What can be positive about this case? It'll give you extremely hard to understand. These are stack of magnets, it's a coin. What can be done to help the patient?
Yeah, the only thing that, well, one, look for complications. So if there's free air, then that will drive you in one direction. If there's no evidence of any complication, just keep in mind that you still might be looking at a stack of magnets. Even if it is a stack of magnets, it might all be within one loop of bowel, and that's not as problematic, at least in the short term, because they will move together as a single object. But just keep in the back of your head that this might be something that you haven't thought of. A stack of magnets is a different sort of thing. So I would be very hesitant saying a solitary foreign body if there's any chance it could be anything else because of this case. All right, what about this case? Free air, okay, great. Why? Okay, people are pointing and they're not on camera, so it's not helpful to the future people out there. But yeah, at the very bottom of the image, remember the edges. There is 3 little metallic foreign bodies that seem to be kind of stuck together. And yeah, these have caused a perforation, and you can see free air. Where are the 2 or 3 places do you see free air here? Under the diaphragm, yep, okay, good. Where? Below the liver, yeah. So kind of the this area, well, right here, yeah. Anybody know what that little triangular bit of free air is called? It's got a cool name. Uh, this one's actually not at the Bell's. This is kind of in the gallbladder fossa region.
Sorry, the D, Doge.
Oh, yeah, you got it. Good job. Okay. Doge's cap, or Doge. I don't know. It's Italian. They were apparently Italian aristocracy, wealthy capitalists in medieval England, or sorry, medieval Italy, and they wore fancy hats that were triangle like that. So some radiologists decided that's what that looked like. Sure. Okay, another case. Foreign body, obvious. What do we think it is? It's a small light bulb. Good, yeah. Yeah. No, light bulbs tend to be lucent except for the base. Yeah.
Maybe magnets.
Maybe magnets. Good. Yeah, maybe magnets. In fact, this is 2 magnets and then a non-magnetic ball bearing. So if you swallow one magnet, it's not a big deal if it's small and it passes. The problem is if you swallow more than one magnet, then they hook together, and that's when you have complications. The same complication can happen if you swallow one magnet and anything metallic that'll stick to a magnet. And that's what this case happened. So lots of toys that are out there for kids that have magnets in them actually have very small magnets, and then the things that people think are the magnet part of these toys are just these metal ball bearings. But it's common to swallow both of them if you're swallowing them. So in this case, the kids swallowed 2 of the little magnetic parts and then one of the ball bearing parts, and they all stuck together. It causes the same problem. So just keep that in mind as well. I'm not sure if you guys are familiar with these. These are another type of magnetic toys. These are pretty big. They're like maybe 5 centimeters, 6 centimeters long, a couple centimeters wide. And they're real smooth and they're real pleasant. And they look like giant pills, and I bet they go down real easy. And you can just look at them and you're like, man, I kind of want to just put that in my mouth. I can see the appeal to it. And if you're a toddler or a kid, yeah, it goes right down. And if you swallow one, again, maybe not such a big deal. If you swallow 2, man, they stick together and they do not come out. And then GI gets real excited because they're like, oh, we can go in and just grab this thing, pull it out. The problem is they go in with their metal scope and these things just stick onto the scope and they can't actually get them off. So they can pull the scope out and the GE junction just kind of pops it off of there. But there's no way, once they stuck together in the stomach, to get them apart endoscopically. So when they're large magnetic foreign bodies like this, they oftentimes end up needing to go to the OR and have them surgically removed, which is what happened in this case. How about this one? Magnets again. Why aren't these magnets stuck together? Magnets like to stick to each other. These 2 aren't. Any? It depends on the orientation, but Tish?
I think there's like a lucency between like a bar.
Yeah, yeah. It's pretty subtle there. You can see that little linear lucency between 2. So these toys of these kids, these building blocks that are made out of magnets, they have very tiny magnets that are glued into these plastic rods. The whole thing isn't a magnet. It's just 2 little bitty magnets with a plastic rod in between. And this kid swallowed that rod. And so these 2 magnets are physically held apart because they're glued into the plastic rod. The problem is that as it goes through your stomach, the glue dissolves and these things pop out and then they connect to each other with bowel in between. And so that is an issue. All right. Here's a case that is published in the literature. And it's kind of fun. So there's a conglomeration of foreign bodies. Pretty obvious. Anybody want to guess what they are?
Pony beads in between. Batteries?
Okay. You're going to have to explain to me what pony beads, is that what you
Like
said?
those things you like make bracelets. There's like beads, you put strings in it.
Are they metallic?
No.
Okay, then these are it's not these are metallic. But you're right about the other thing you said. So the ones with the arrows are batteries. So this kid swallowed batteries and a bunch of magnets. These are hematite or magnetite. You get them in gift shops sometimes, and they make fun shapes, and you stick them together. I think I have a picture coming up later on in the presentation. But yeah, if you swallow batteries and magnets, then you get compounded all the problems that can happen here. Okay, how about this one? They're metallic, they're foreign bodies. Where do you, I'll tell you they're magnets. They knew that the kid had these, they're called buckyballs, or that's the brand name for this type of magnets. They got temporarily pulled off the shelves, but you can get them again now. I have a bunch in my office. They are fun to play with, I'll admit.
They really are stick together as a string. Do you usually stick from this side? They are side to side?
These buckyballs, because of the way the magnets are, they stick together in strings like this. It's part of what makes them dangerous. So the question that GI is going to have for you when they come into the reading room when you're on call is, where are these? Can I go in with a scope and get them out? What would you tell them? So remember, they can scope this from nose all the way to duodenum. Once it's past the duodenum, they usually can't get it. So where are these? Cannot tell. But what's your best guess? Jejunum? Okay. I thought these were probably in the stomach, actually. Yeah. Yeah. It's a little hard because the lateral view, it's kind of posterior, but the frontal view is pretty clearly in the correct position. And if you think of your upper GIs when you're doing the gastric portion of your upper GI, this is a reasonable place. I would say it's worth going in to check. Because if you can do it endoscopically, it's a lot better than having to go in surgically and do it later. So ideally, they would go in endoscopically and get these if they can. So if you tell them they're in the stomach, or it might be in the stomach, they'll go look. And that's what they did. So here we go. What do we think? This is in the stomach. We see any problems here? Okay, good. You guys counted on the original one, I'm sure, and you saw that there were 4. How many are we seeing here? 2.5. Good. So there's 3 in the stomach. 1 is kind of embedded in the mucosa of the stomach. That's why it looks like a half of one. And the 4th one is not there. In fact, the 4th one ended up being in the jejunum. And these magnets are so strong that they can't, again, get them apart endoscopically. This kid ended up having to go to the OR to get these separated. These were removed. The 4th one was allowed to pass, and thankfully didn't perforate or force or do anything, but did have a small erosion in the gastric wall. So here's a close-up view of the same case. Those 3 were jejunal, or those 3 were gastric, and one additional one was jejunal. If you look really closely, maybe I can convince you that there's a little bit less overlap of that last magnet compared to the first 3. That's a tough call. I don't think it may not be a true thing. I have seen this on subsequent exams of the same types of magnets, that can be subtle differences in the distance between the 2 that indicate that there might be a loop of bowel in between. The bowel wall is real thin, so I would not rely on this. It is not published yet. Another example, I don't know why kids just love to eat these things. They must, yeah. So these are those hematite or magnetic iron ore beads. This kid swallowed a bunch and they made a nice ring in the stomach. These happened to be in the stomach. Here's an example from the news. This is just online, so it's not a patient from here, but they published the x-ray, which was fairly typical. This kid swallowed a whole bunch of buckyballs. And I think this kid had 7 different loops of bowel that were all interposed between these. Had to have big surgery. And then they took a picture taunting the child with the magnets that she swallowed. And you can see it, needed a big operation, complications. We have had a case here at Children's where we did this. The kid swallowed a bunch, and you'd go to the OR, have them removed, and the parents were like, "Hey, we paid a lot of money to have these things removed, and our kid get healthy again. We want those as a souvenir." And the surgeons were like, "Sure, take them." They put them into a drawer on the bottom level, and the kid came back, swallowed the exact same beads again. Yeah, it's terrible. Yeah, so just common sense goes a long way. This is a 2011 paper. I think it's been updated now. I should update my talk on the management of ingested foreign bodies, and it has a lot of detail that GI and surgery will go through, but it's useful to know that this exists out there. It is published in GI endoscopy by NAFSCAN, North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition. And it goes through some of the criteria that we use as far as ingested foreign bodies and what to do about them when. Again, you don't have to memorize this. You won't be tested on any of this. Just know it exists so that you can look it up. But it's more for our colleagues. Some general rules of thumb. If you have an example of a foreign body that you're concerned about, in fact, there's our protocol here that the text will ask about, hey, do you have an example of what it is, so that we can see it? And they'll actually take an x-ray or put it next to the patient, so that we know what we're looking for. Because if we don't know what we're looking for, it can be hard sometimes. This is a patient who apparently swallowed something, and the parents thought it might be the magnets from these magnetic dartboards that they had. Turns out the kid did swallow something, but it was some other something or another that we didn't really know what it was, but didn't look the same as the magnets from the darts that the parents brought in for us, which was good. So this was allowed to pass. The kid was asymptomatic and did fine. Iatrogenic foreign bodies can be tricky too, but use that same trick. This was a case early on in my career where the surgeons called and said, hey, our count is off and we're missing a vessel loop. And I was like, what's a vessel loop? I don't even know what that is. And so the surgeons were like, oh, it's this kind of rubber thing that we use to loop around vessels and pull them out of the way for surgery. I was like, okay, well, I don't really know what it looks like on x-ray. Do you have an extra one? Can you put it next to the patient? So here, off to the side of the image there, you can see the vessel loop that they provided for me to look at. And I was like, okay, well, here in your surgical site, we got a bunch of lines and drains and tubes and stuff, but I don't see anything that looks like the thing that you guys are missing. So it's not in the patient. Wherever it went, either you miscounted or it's on the floor somewhere in the trash. So that's a helpful thing if you remember to think about it. Problem solving. Foreign bodies can be in other places too, not just ingested. This is a 10-year-old girl with headaches, and they thought she might be having jaw pain. So they brought her in for a TMJ MR, and we have this weird artifact. She had passed through all of our screening without any problems. The metal detector, the questionnaire, everything was fine, but this looks like metal artifact that you see on MRI. And when we went out and questioned the parents, they're like, oh yeah, 8 years ago, we had T-tubes put in, tympanoscopy tubes. And this was back in the day when T-tubes were metallic. And 8 years later, they were still in the patient's ear. So I actually went and washed out the kid's ear and found those little metallic, they were very corroded and kind of fell apart. They were in a big glob of wax and it all kind of fell out. It was a pain to get it out. In fact, didn't show on the x-ray, which was the next step if you're worried about foreign bodies like this. I could get an x-ray, but couldn't see it. But that's what's causing the problem, but it was obscuring the TMJ because of course it's like right there. So don't know why that one's blank. This is a fun case of another foreign body. History, fishbone caught in throat. I'll admit this was not a case from Children's. This was a case from Harborview. Anybody know what we're looking at here? There's something like this. Undulating contour. Yeah, okay, good. Well, let's step back for a second. Tell me, is there a complication that we see? Yes. Air, yeah. So there's retropharyngeal air. Okay. So we have a foreign body and we have retropharyngeal air. We're worried about perforation. That kind of forces our hand in some ways, but it's nice to know what we're dealing with. And in fact, the history is accurate in this case, kind of.
It's not only the fish one, there's something around it too. It's a fish, yeah.
It's a whole fish. Yeah, it is a fish bone. It is a lot of fish bones. It's the whole fish. And unfortunately, I can't go back again because of the recording. But that's an outline of the fish. Apparently, there was some bar in Seattle, in Ballard somewhere, that doesn't exist anymore, where they would have races of fish races. And you would bet on the fish racing in a trough. And the winner or the loser, or in some way, like somebody ended up having to eat a fish at the end. And this person ate the fish. It was big, and when it went and got stuck right here, and then its little fins like poked out and poked into this kid's, or kid, I say kid, this was not a kid, into this person's soft tissues and caused the pneumomediastinum. Thankfully, it didn't obstruct the airway, but clearly was causing problems. Had to come in and get it surgically removed, chunk by chunk. Apparently, they had to like break it apart into pieces to get it to come out. So pretty gnarly. The fish didn't survive, but at least he did some damage on his way out, I suppose. At a Christmas party, anybody want to guess? This is slightly fibbing. This was after a Christmas party, not during a Christmas party. You guys know what this is? Close. This is a jingle bell. It's a jingle bell. So you can see the outer metallic part and then the little ball part in the middle. It was presumably filled with fluid in the stomach, and it didn't actually jingle in the patient, but would have been a cool story if it actually had made noise. Kind of looks like this. You guys know what jingle bells. Playing with glass. Glass is a special case. Depending on the size and the thickness and the density, and whether it's leaded or unleaded, it can have variable appearance. Most glass is radiodense. You can see it. I think the quoted literature is somewhere like 70 to 80% of the time, but it depends on lots of other factors. But you can see it in general, so it's worth looking if you're concerned. This kid was playing with safety glass that had broken, and has all those little tiny kind of rectangular pieces, and just decided to eat some because they did. True story, this one, fed up with brother reading her diary. So she swallowed the key. It's one of these diaries that has a little key to it, and she's like, nobody's gonna read this diary. Even me. Yeah. So swallow the key. There you go. Drinking from dad's can. This is a pretty common one that we get. People are always saying that they swallowed these things, and x-rays are appropriate to do in this setting. Just keep in mind that these are really subtle sometimes. Aluminum is a very thin, well, in this setting, a thin aluminum is very hard to see. So you can see it hanging out there in the stomach on the image on the left. Magnified up, it looks like that. And I have a couple different views. It's partially obscured by my head again, but this is what you're looking for when you're looking for soda tabs. Very hard to see. And if you don't see it, it could be that it's just embedded in poop or gastric contents. They tend not to cause problems, so it's usually not a big deal. They're not that big. This case is disappointing to me because while the prior x-ray tech did lose their marker, when they imaged the kid the next day and found the marker, it was on the wrong side. So it's an L, but it's on the patient's right. I couldn't even fake it and reverse the image because then the stomach would be on the wrong side. Anyway, that is a radiology marker. It was left in there in the kid's room, and they did swallow it. This is a child that has autism, abnormal stool. They have a new sandbox, and they just went into that sandbox and went to town. Just got a spoon, and so this is what sand and gravel and sticks, presumably, and twigs and cat poop and whatever else was in the sandbox looks like. Has a nice outline of the colon, and apparently the poop was coming out, and it looked just like sand and gravel. So got this picture. A not insignificant number of kids with developmental delays of some sort or autism or something along those lines will be the ones that you're imaging in this setting. And I think the literature says that it's about 50%. 50% of the kids will have some sort of developmental abnormality, but on the other hand, 50% don't. So it's just some normal 8-year-old who decided, hey, that thing looks good to eat. These are some cases of construction mishaps, obvious but kind of fun. Nail gun party. One in the skull, hands, knee, but no diagnostic dilemma here. This is a kid who got in a fight at school. And this is a pencil. This is what a pencil looks like. It was stabbed into his thigh and then broken off. So you can see the graphite central component and then the outer paint layers of the yellow paint that's always on these pencils. So you can see graphite is a little bit denser than soft tissue, but not as dense as like metal would be. I'm surprised it's that dense actually. This one is a kind of relatively benign looking radiograph, but causes big, big problems. So safety pins, when you swallow them and they're in this orientation, are a real, real problem to get out. You cannot take them out endoscopically. They tend to cause big problems. They almost always have to relatively urgently go to the OR and get these externally taken out. Yeah, these are big problems. So look carefully for these. The other thing, summer is ending now, and ignoring this kid's retainer dental hardware that's in place, there's another foreign body here. Do you guys see it? Oh, at the epiglottis. Yeah, do you know what it is?
Wire.
It's a wire from what? Not from the braces, no. So this kid was at a barbecue.
No bristle.
Yeah, good. This is the bristle from a brush, a wire brush that's used to clean grills. Very common. You're scrubbing with the wire brush, and the little wires, they just pop off. In fact, I look now every time I clean my grill at home, because I have one of these wire brushes, and I look, and sure enough, there's like little bits of wire like that are off to the side. And if you're cooking a hamburger and it just gets embedded and then it goes down. You can see it when it's in a space like this. Oftentimes when this goes down into the stomach and beyond, they're so small and so thin that you're not able to see them anymore. I have several cases where I know that it's there because surgically they went in and took these things out, and going back and looking at the x-ray, knowing where to look, you still can't see it. But this is what we're looking for when we're talking about wire brushes. And I